Hello, you're welcome to another interesting episode of Inside Abia with me, Agatha Mata. This week we'll be looking at different sectors, and I'm going to start off with a did you know? Did you know that maternal and child mortality reduced by 71% between 2019 and 2021? This is a verifiable fact from the World Health Organization. Now, that is shocking to me, and that's why I started it. Because if you live in Nigeria, you will know that there was some drama about something that the governor said. And I told him I was going to ask him, because I need an explanation, which is the controversial 500 naira. Let me ask you, healthcare, you have phenomenal records. I mean, I was looking at the paperwork you gave me, which are all verifiable. And when you put that pari passu with the kind of controversy you see online concerning what you said, I'm wondering, how did that come about and what exactly did you mean? Because the facts on the ground says you're doing well in healthcare, and then what's online says something else. And I think we shouldn't sweep this under the carpet. So let's hit the ground running.
Thank you very much. Permit me to take the liberty of responding to that question last.
Okay.
Because it is not as important
as what
as
you
the
have
facts
done.
And figures.
Yes, maybe the facts and the figures would let that go.
That's not an issue at all, and I don't have no regrets at all about that. I even did that yesterday. I gave women money yesterday. I'll give again tomorrow. So, in 2015, when we were looking at the health sector, health for us is an enabler. It supports the pillars, because if you want to create a better life for your people, and they are in trade and commerce, small scale manufacturing, and agriculture, and all of that, you need to have them healthy.
Correct.
Because health affects productivity. True. In SME. Health affects somebody in the agri sector. So health is important. And if you want to make Abia a premier destination for business, not only in Nigeria, in Africa, you also need to speak to health issues, because those who will come, the investors that will come, will want to see, and then if you are lucky, you can begin to reverse health tourism. So that is at the apex. But fundamentally speaking, can I provide sufficient services in terms of health to make my people healthy?
But you're concentrating on maternal and child?
Yeah,
or?
I'm coming. Because, yes, you must define the problem.
Okay.
So, how do you know or calibrate the impact of your effort in the health sector? And the only way is for you to set a target for yourself. So, for us in Abia, our target is to make sure that our life expectancy is above the national average. Whatever the national average is today, if it is 47, some people say 56, whatever it is, we want to move our life expectancy higher to 60, if possible 65. In Cuba has a higher life expectancy than even America. It's 84 years for females and about 82, 83 for males. In Cuba, that is higher than 79, 80 that America has today. So you
looked at their model.
I invited the ambassador. So he spent an evening with me in Abia. And he said to me that what they do differently is that in Nigeria we do 3 tiers: primary health care, secondary health care, and tertiary health care. That they do 5 tiers. They have at the community, at the family level, a cluster of households have a care doctor, a doctor that takes care of a cluster of households. Beyond that, they have their primary health care. On top of that, they have the secondary health care. On top of that, they have the tertiary health care. They have super tertiary that thinks about research and, looking at issues of etiology, epidemiology, drug design and delivery, and all of that. So, and I said, what do I have to do? I inherited about 755 primary health care centers. And so what I needed to do was to make them functional in the first place. And again, if I want to improve the life expectancy of my people, I must be able to look at the vulnerable extremes. So, maternal and child care on my left, and then the geriatrics on my right. So, In between them is the middle-aged people. Abia is perhaps one of the few states in Nigeria that runs a geriatric outreach anchored by a diasporan called Dr. Osondo. He goes from community to community to look after people that are 70 years and above. Look at their drugs, make sure that they take their drugs at the right time. Even look at their personal hygiene. Oh, yeah. Look, some people, all they need is just, diabetic sore. You change the dressing, you ask them. Some of them may not even know how close the next primary health care. So you key them in and they become registered in the primary health care center. And so globally, the aim is to bring people into the public health loop rather than attend to quacks, whether you call them chemists or you call them traditional birth attendants. We want to bring as many people into the loop, because if you've not been examined, if you've not seen a proper doctor, you may not even know what the problem is. I'll give you an example. Typhoid and malaria will present the same symptoms. So somebody loads you with chloroquine, and at the end of the day, lab test says it is typhoid. You would have abused chloroquine, and that leads to drug resistance in the community and all of that. So we needed to bring people into our loop and look at them. So the geriatric outreach is running, and we are happy with the testimonies we get.
How regularly is this done?
They have a schedule. And they have, apart from a schedule, they even do follow-ups. And they use people, nurses and attendants from your local government to deal with communities within that local government, so that we can erase the dialects and the language issues and all of that. And people can care. They can come back and look at what is being done. Then, on the left extreme, where we have mother and child, that's where the big issue is. Because you have issue of so many people outside the primary health care loop. They patronize whosoever they patronize. If there's a new wife in the family, for instance, the chances are 7 out of 10 that the mother-in-law will recommend that the daughter-in-law goes to the same traditional birth attendant where she patronized.
Really?
It's your mother, your daughter-in-law is, once she gets pregnant, you want to take over and let her go through the same, and is confused also by religious beliefs. So what we try to do is how do we bring women into our primary health care loop? First, bring them to attend hospital or primary health care centers and talk about their problems. 2, get them to attend antenatal clinics and then deliver in the hospital. So, how many people have been brought into the loop? How many people are attending antenatal? How many deliveries have you conducted now? How many deaths have you had? That is the statistics between what the Ministry of Federal Ministry of Health and World Bank just published was a study of 3 years, 2019, 2020, and 2021. What do we do? In our primary health care centers, we are trying hard to make sure that we get the attention of our women to bring their children. Most important thing is not even the woman alone. It is the fact that once you key into our primary health care loop, vaccinations are also free. So we have to care for the child until 5 years.
So it's important to get the mother into that.
That is why
system.
we have 0 case of polio in Abia, because women are now in our loop, and we will continue to reinforce that. So we needed to insectify, because people don't have belief in what government is doing. So if you just say, come to my clinic, after all, the average cost of delivery in Nigeria today is between 50 and 100,000. So delivery is free, Free delivery pack is about 20,000, all the plastics, and we give you one per child. If you have a second child, a new set of delivery pack. So antenatal is free, delivery is free, and then the birth pack is free. Yes, all of this in the hospital, but how do we get you to come? We needed to provide an incentive.
So that was the incentive?
That was the incentive. And it worked. That is why we had initially number of people that has patronized hospital moved up by 14.4%.
Just because you included money as an incentive?
Number of people attending antenatal moved up by 30%. Wow. Number of deliveries moved up by 30%. Now, the deliveries, maternal and infant mortality, reduced by 71%. Why will everybody tell me to stop? I even want to make it 90%. Because I have a policy that if I lose a child, I need to know. The nurse attendant, the matron, has to let me know. It's not because I do not know that, life is in the hand of God, but I want to know what we can do differently. So I care for that unborn child. I must give that unborn child an opportunity to live. Whatever incentive I need to provide for the mother to come and deliver that baby.
So it's not even about the money, it's the incentive. So it's the free spoon, it's the free gift in the pack of conflict.
Exactly.
Okay, I get it.
Exactly.
So it's not about that. So it's like saying you have 2 packs of conflicts, one has a free spoon attached. Naturally, a lot of people will just go and buy the one with the free spoon. Not because they need a free spoon, but because there's a free spoon.
Exactly.
Because people like free things.
Exactly.
So I get the analogy.
So whatever strategy I will use to attract the attention and bring women into that net. Abia is the second best state in Nigeria in terms of primary health care, and the best in the Southeast.
Really?
The Federal Ministry of Health will confirm this. And curious minds, those who are smart, will want to know how. It is because we are intentional about, first of all, reining in our women and their children into the primary health care loop. But because they have started coming, we needed to scale up our services. So we set up an Abia Telehealth that was launched in 2016 by the Vice President. This Telehealth today has connected almost 800 primary health care centers we have, all of them.
Can I hold you? I know what telehealth is, but for the benefit of those who don't know, can you please explain it?
Well, we have a hub in Government House somewhere here, where 15 doctors or so work round the clock. And they speak all the dialects, vernacular and everything there. Telehealth is an initiative that connects our entire health architecture to a team of doctors, because we understand that we can't put doctors in every primary health care center. And so it's not only even for the benefit of the patients, mother, child, geriatric outreach and everybody. No, it is also for the benefit of the health care providers. Because you have a nurse. I remember a typical dramatic instance just about the time we launched the telehealth. We provided vacuum delivery device for our matrons and birth attendants in the primary health care centers. So one of those matrons in a local government called Osisioma could not manipulate, and she had a delivery. She had a delivery, and the head of the baby had engaged, and she didn't know what to do. So she quickly dialed the call center, and the doctor picked up, and they put it on WhatsApp, and he said, okay, I can see what you are doing. Engage this way, do this way, do this way. And we had a self-delivery.
That is amazing.
So it supports the healthcare provider and also supports the patients.
Hello, good morning. I'm Dr. Chimobi from Dial a Doc Direct, Abia State Telehealth Initiative.
I'm Dike Ngozi, OI Samusuku Health Center.
Yeah, good morning. How may I be of help to you?
Doc, I have a patient.
physician population ratio in Nigeria is about 1 to 6,000. WHO recommends 1 to 600. So what Dr. Ekpeazu has done is to bridge that gap. There are people, there's a significant population of Nigerians who would die without being diagnosed or seen by a medical doctor, but they have a phone. So what Dr. Ekpeazu has done is to say such people deserve, it's equity. Telehealth is equity. It drives healthcare, not just healthcare, reliable healthcare to the grassroots. All you need is a phone.
We said I should alternate Rangers lactate with the normal saline, 500 ml. I should give IV Promet, 1 ampoule. Then IV Flagyl, TDS. When I call the doctor, I will tell the doctor my name, where I'm calling from. Then I will find out the doctor I'm speaking with. Then I will tell the doctor the client's name, her age, and the complaint the client came with. I will also tell the doctor the vital signs that I've taken. If I've started any treatment already, I will then tell the doctor, see the treatment that I've started already. Then the doctor will tell me the next thing to do. Then the doctor will also tell me some tests, important tests or examination that I'm supposed to carry on the client. Then some treatment to augment if I've already started. The doctor will say, okay, remove this, or put this to add to the treatment. Then if it is a client that I'm not supposed to handle or a client that is somehow above my limits, the doctor will tell me, please refer this case.
It has improved my knowledge in the practice. It has promoted my knowledge. It has created confidence in me that when I have any patient, any condition at hand that I cannot manage, I call them. If it is what they can manage, they will tell me what to do. If it is what I should refer, and I will refer immediately. Coming to the community, it has helped them, making health accessible and available, affordable to them at any time. Because this line that we used to give it's pasted in the front of my facility to all the patients that are coming here. When you have any need at any time, dial the number. Once you die, please, nurse, I have so issue. I will equally pick, just as Telehealth do pick their own, I will pick and know why they are calling. So because of that, it has helped a lot to improve the health and the acceptability of the community people towards health. And another thing, it has reduced very well, reducing mortality rate in the community. And it is being welcomed by everybody. So because of that, it has made them at their comfort zone. They can call at any time before coming to the health center. Please, nurse, this is what is happening to me. I want to come immediately. Or if it is what I will say, come. If it is what I will say, do this in your home. It will be solved. So it has really helped a lot.
It's also popular among students because you have in the middle of an exam and something happens, you have a cramp, you have something.
It's available to everyone.
It's available. So Abia Telehealth has actually deepened healthcare delivery, and the impact of this was published in UK. That I think that journal described it as a smart and innovative way to deepen healthcare delivery in Africa. I have presented a paper in Rwanda in a conference called Digital Africa on Abia Telehealth. So it's recognized world over.
So let me ask a question, because I while I've heard of it, I don't. Is it that they have contact numbers and anybody has access to those numbers?
Of course they do.
Or do you have to go to a hospital to get access?
No. They have contact numbers. In fact, as I speak, we are at the nick of collaborating with one of the local service providers that will roll out hundreds of thousands of devices and telephones and SIMs, so that we can even in the market now have a cluster and they can be on the same platform real time with our doctors and all of that.
The telephone doctor package is basically a doctor, a remote doctor in your home. So what it does is, if you have this in a household, you have direct access to our call center. Over and beyond that is you have a designated doctor from our call center that would help manage your household. So imagine a household that has babies, elderlies, maybe 1 or 2 persons living with some chronic diseases. You have a doctor calling on first integration to get the data of all members of the household. So names, age, phone numbers, diseases they are living with, children of immunizable age. And then it's designed for the doctor to check in even if they're not calling to complain about symptoms.
So the idea is that for now, all our primary health care centers, all our health facilities connected. Our Abia Emergency Service, which is a special service made available for middle age, those who are not geriatric and those who are not mother and child, in between. Those who could go down with cardiovascular accident, those who could go down with road traffic accident, which is a major cause of death in Africa. They have an emergency service that an ambulance that runs 24 hours, linked to the police, so that if you call by 2 o'clock, the ambulance will raise police and they can go and attend. That also is anchored by a diaspora Abian in America. So this is the healthcare framework for us in Abia. And we have made sure that we are doing a mother and care specialist hospital. As I speak to you today, the building is about being completed. We have finished everything, we're just furnishing it. And we have 6 container loads of medical equipment. So we are going to have a mother and child specialist hospital. So not only are we providing services at the primary health care center, we are ready to go the whole hog up until specialist care for mother and child, and indeed the entire gamut of pediatrics, in our mother and child specialist hospital in Umuahia. And we are naming the building after Mrs. Jackson, who gave us part of the medical equipment with which we are equipping the hospital in Colorado, in the United States. So this is the reason why Abia health infrastructure is looking upwards. We have renovated 4 general hospitals. The secondary health care centers that we have renovated, 4 of them, we have tried to make them referral points for the primary health care centers. So if we look at the map and we see a cluster of primary health care centers and we locate centrally a general hospital, we renovate that general hospital and make sure that it serves as a referral point. And before you leave, I will like you to see one of the purpose-built hospitals we imported from Germany. One of them is around here. And the idea is for those purpose-built hospitals to serve as a linkage between the various primary health care centers. I'm just speaking about a scenario where, suddenly there's need for cesarean section.
Yes, I was going to say, when there's an emergency.
So I have a mobile theater, I have a mobile delivery van, straight from Germany. So the idea is for those to run shuttles between, exactly, and also support.
So if there's an emergency, they go there and they have everything on board. They have
everything there to deal with it.
Cater for an emergency.
Exactly. So that is, and then what am I looking at tomorrow? I am believing God that I'll be able to complete the health village that I am trying to do.
The what?
Health village.
Health village.
Yes. This health village will completely reverse medical tourism.
I thought so.
It's going to have a kidney and heart center, and I'm speaking to one of the best heart surgeons in Nigeria today. He is from Abia. It is going to also have a polyclinic, a clinic that looks at everything. So all the regular medical checkup that we go overseas to do will be done there. And we are seeking the support of the central bank. We have signed up for a medical support of 2.5 billion.
I'd like to say a very big thank you to you, Your Excellency. Thank you for your time.
Thank you for
Thank you for
me.
your patience. So viewers,
My pleasure.
We have come to the end of another interesting episode of Inside Abia with me. Next week, we'll be looking at some other sectors of the economy with His Excellency leading the way. So on this note, I say bye-bye and see you next week.